I'll call the meeting to order. I'll introduce myself. I'm Kay Leach, and I'm the current chair for the Board of Health. And Board of Health members are here with us today, and I'm going to ask them to introduce themselves. Carol, would you start, please?
I'm Carol Chalukian. I'm on the health board. I'm a pediatrician.
Mark.
Mark Norrell. I teach at the School of Public Environmental Affairs at Indiana University. I teach in the Healthcare Management and Policy program there.
George.
George Hageman, retired microbiologist from IU's biology department and member of the board.
Steve.
Steve Pritchard, board member, retired dentist.
And our Monroe County Health Board, our Health Department Administrator, Penny.
Penny, and Dr. Sharp's here as well.
He's always hiding from us, though.
Yes, yes.
And Margie.
Hello, I'm the attorney for the Health Department. I'm Margie Rice. Thanks for having me today.
And I see a couple of other people that are here today. Nicole, you want to introduce yourself?
Hello, I'm Nicole Wagner. I'm the Chief Food Sanitarian for the Monroe County Health Department.
And Aaron?
I'm Aaron Waltz. I'm with Security Pro, part of the compliance officer program.
Okay. And those are the only people that I see on my screen. I think that's everybody that was supposed to attend from the board, isn't it, Penny?
Yes, it is.
Okay. Next, is there any public comment out there? The board always gives the public the opportunity to bring any issues before the board that they'd like to. So if you have anybody out there, or if there is anybody out there that would like to make a comment to the board, just please hit the raise your hand at the bottom of your screen, and our technical person will let us know.
There are no hands raised.
No hands are raised. Okay, so no public comment right now. We'll try that again a little bit later on. Next on our agenda is approval of the minutes from November 5th. Did everybody on the board have a chance to go over those minutes?
Yes, I did.
Anybody find something that needs to be corrected, or?
I would move that we accept the minutes as presented.
Second.
Mark, I heard that from Steve, and I saw Mark's mouth move. I think you're muted, Mark.
I'll second that.
Okay. So we have approval that the minutes will are approved as written. Okay, we're moving right along. Next on our agenda is old and continuing business. Penny, you want to give us a status update?
Sure. We'll try to just kind of give a few things. So Clark Davis started with us on November 16th as our new disease intervention specialist. At our last meeting, we had talked about an offer was out and they were expected to start, and he has started with us. We're glad to have him on our team. He came to us from Positive Link, so we have good connections with him. He had already worked with the staff. They knew him, and he's got great skills that we had seen in action before he came to our team. So we're happy to steal him from them. You know, that's always good. We have, in terms of staff reports, our community testing site is open. It opened on November 16th as planned. It has been off to a little slow start, and as with all testing sites, even with the Optum site, if you remember back when it opened, it was a slow start and we had some challenges to work through with that. And we are doing the same with this site, but they are up, they are open. We encourage people to schedule an appointment. Please try to complete that registration all the way through, and then your visit there will be very quick. We are going to start trying to take some walk-ins. We did not accept walk-ins initially. We wanted a chance, because that registration is longer, we wanted a chance to really kind of get settled before we started taking walk-ins. So they're going to start taking those on a limited basis as best they can, and we'll kind of work through that as well. So far, they have done about 700 tests in the first week and a half, with about a 3% positivity rate. Now, the good and the bad, it took anywhere from 2 days to 7 days. And I think maybe a time or two, I've heard someone say that they waited 8 days for results, but it's been about an average of 4 days to get the results. One of the things that we found this and other health departments across the state, because we're all using the same platform, Zotec, to get results, that some of them they've been posted, so the tests are done, but there have been glitches with people actually being able to access those results. So the state's aware, the state is the group to work with Zotec to get that resolved. They're working on that. And what we are doing on our end is trying to put in some systems and processes that the clinic staff here can help troubleshoot some of those in the meantime to ensure people get results if they haven't gotten them in the time that they were told to get them. We had a few people that would get an email saying that their test results were ready. And then when they would go in, it would tell them that they were pending when in fact they were ready. So then you have to call the state to get those. So that's been part of that barrier that we're trying to work through. So just kind of in terms of awareness and transparency, that's a challenge and a barrier, but we are working very hard to resolve that for people. So send people that way. When they go to the main website, they'll have an option for Optum and an option for community testing sites. So we would encourage people to pick whichever location is easiest for them.
Can I say something about? Yeah, I actually went there just to check it out, and I was going to go see my grandkids, so I decided to get a test, which was negative. But it took me 5 days to get it back. It was the posterior nasal swab. It wasn't the anterior like they do at the Optum site, so that's always stimulating. But it went very quickly. When I got there, it went really quickly because I had pre-registered. I noticed that, and you mentioned this before, Steve, that this area where they have marked off for people who didn't get all the paperwork done beforehand, it seemed a little congested to me too. I agree with what you said about that. It just seemed like this little tiny spot that they have five X's in. And I'm sure it's measured out to be at least 6 feet, but it just seemed a little tight from considering how big that space is. It seemed like they could have given them more space between them. But it went really well.
Okay.
Although it did take 5 days to get my result back.
I have a question too, Penny. I know at Optum, you get your results, or I've got my results by email. And I heard of someone this week who got results that were positive, and it was a letter from the state. Now, do you get it? Did they send the positives out with a letter and negatives with a, or was that an unusual?
When people register, if they have an email or a phone, they should register for how they want their test results. So they could get it by text or by email. For some people that don't have that access, they're given a phone number. So if they got a letter from the state, I would say that there was some issue or way that they weren't able to get them their results some other way and didn't connect, so they sent those out. I don't have an exact answer, but based on what I know, that would be my expectation.
And I would think that that's probably what happened. Okay.
Yes. Anything else about the testing site?
Do you know for sure when Optum is closing?
We do not. We know that it's up at least through December. The state, I would anticipate in the next week or two, will make a decision. And honestly, my expectation is that as long as we are seeing these increases in cases, I think that they will keep them open because having adequate testing is vital to all of this. So I could be wrong, but I would anticipate that they will keep them open until our numbers start to stabilize.
I have another question too. Is there any what kind of efforts are being made to get the turnaround to be a little faster? I mean, it really shouldn't be more than 48 hours. And you know, finding out 5 days later really doesn't change your life a whole lot.
Right, exactly. And so I'm glad you asked that, because when I paused a moment ago, it's like there was something that came in my mind I wanted to tell you. And that was exactly what it was. So the lab coordinator, the state coordinates all of this, and those tests go out to various labs. So that can have something to do with who gets them. As you know, one lab may have fewer being sent to them for some reason. So the state indicated yesterday that they are adding some additional labs to try to take some of the demand off of the few labs that they have. I know the state lab has been working 7 days a week, and they're just trying to add additional labs to handle that influx. So we saw this in the spring, you know, in this early summer as well, with a backlog, with the high number of tests positive and that kind of thing. But they are working to reduce that. They are well aware of it. And you're right, it's an issue because it comes a point where you just need to quarantine and, you know, do what you're supposed to do if you can't get tested or get results back. I mean, in some cases, you may have been through isolation by the time you got your results back, right? And certainly if someone's symptomatic, we want them to isolate at least until they get those results back. Once they're back, if they're negative, then they can move on. But the other thing that I would say in terms of that, the CDC is changing their guidance around quarantine, and they are shortening that from 14 days down to 7 to 10, 7 days with a negative test after day 5, or with no test and no symptoms, of course, it's 10 days. People should still monitor for potential symptoms because the incubation period is not changing, but it is most likely that someone will become positive by that 5 to 7 days. So 5 days seems to be the sweet spot that they have found and feel like that is adequate. So that's a change. The last I looked today, it was not posted yet on the CDC's website. It is supposed to be up today or tomorrow, along with some frequently asked questions about why that change came. And then we have submitted our vaccine plans. Those were due yesterday. That was submitted. The hospitals are prepared to accept vaccine in the next week or 10 days. And once the emergency use authorization is given to have vaccine and to immediately start vaccinating healthcare personnel. So that starts with the hospitals and healthcare personnel who deal specifically with people who are infected or likely infected. And there's a triage system of who gets vaccinated in phase 1A, phase 1B, and on down the road. Today, Brian Shockney with the hospital indicated that when they give someone their first dose, they will be scheduling their appointment for the second dose at that time. So that will help us. It's very important people get the second dose because with this vaccine, that second dose is what's really giving people the immunity, as opposed to many vaccines. The second one is kind of a booster. The second one in this is extremely important. So they'll be scheduling that at the time. And we anticipate that the first of the year, we will be starting to do some small pods for vulnerable populations and then easing out into community clinics as we get into spring. Timing's everything. So that's kind of where we are on that.
Penny, I saw that we were getting our first dose of 5,000 doses and something about our 5-county area. It was, I think, in the minutes. Do you know what I'm talking about? No, not minutes, but something we received. And to me, that did not sound like very much, 5,000 doses in a 5-county area. But is that just for the first line of healthcare workers?
I don't think that, and boy, I'm going to have to go back and see what, because I don't recall that. So
Yeah, I saw that too, and I
Amy
was
Meeks sent it out.
uncertain. Yeah.
Okay. Well, Amy has certainly been with the hospital, and she is on here. So if Michelle, if you can let Amy Meek through, she is tuned in, and she'll be able to answer that. I know that the hospital has been, Dr. Weaver is at the State Health Department, is leading the charge with vaccine and vaccine distribution, and they've been talking with the hospitals. Amy's been a part of that. I don't know if they have, because the state with us has not indicated that they know exactly how much vaccine they're going to get, but it's how it will come. So Amy, I'm going to let you take that.
Yeah, so that was in the notes that I had sent. So the hospital is expecting to get around 5,000 doses for our 5-county region. So IU Health Bloomington Hospital is one of the 1A sites, and they'll be responsible for vaccinating Monroe, Lawrence, well, my memory now. So Owen, Greene, and I think it was Brown County, according to the state's map. And that'll be healthcare workers, long-term care facility workers, hospital workers for that region. So not just IU Health workers, but any healthcare worker. So when we receive our allotment, and that number changes every day, but that's what we've been told we're expecting of the Pfizer dose, whatever we receive, the state will hold back that same amount for us so that in a month we receive it again, so that everyone's guaranteed to get that second dose and there won't be a shortage that way.
Amy, so the allotment is going to come to the hospital, and then it's up to IU Health Bloomington Hospital then to apportion it out. Is that who's making the decision from that allotment on down through to all the different providers, including long-term care, skilled nursing facilities and such?
So the state is making that decision of who gets vaccinated. There'll be a portal that we'll be using called Zotec, and they'll make appointments through that. So, it'll be in some ways first come, first serve as who's signed up first in the Zotec system, but it'll go out to all the healthcare workers in those 5-county areas. So it won't be the hospital deciding who gets access to that.
All right. So in other words, you would have to, if you are a frontline healthcare worker in a nursing home somewhere in our 5-county area, you'd have to prove up your credential that you're a frontline worker to sign up.
They're making it pretty loose. So you really just sign up and you show your badge when you get there, so we know that you work for the facility. We're not asking a ton of questions to make sure exactly what you do at each facility. We really just want to get people vaccinated.
Right. And I'm just trying to understand exactly how that's going to work, because first come, first served is really not that good a way to do it.
Yeah.
And I would just encourage the health department and the hospital to work together to make sure that it's not that first come, first served, that there is some way that there's an effective communication coming from the partnership of the health department and IU Health Bloomington Hospital to all those provider settings out there to guide them to, don't just let them willy-nilly first come, first serve, but you can imagine in the hospital who you would want to be first in line. If you allow anybody with a badge, then you're going to get people who are not frontline caregivers. You want the COVID unit people, the clinical staff in the COVID unit first. You want your ER folks. You understand what I'm saying is that there needs to be some oversight from a governance standpoint to make sure that this is done just exactly right, because this is where the rubber meets the road.
Yeah. So it probably wasn't a good term to use, first come, first serve, but the system that is rolling out will be the one that rolls out for every hospital that was chosen. So for example, IU Health Paoli was chosen for some of the counties, and Jasper Memorial, I know, is on that list of some of those counties in that area. So the state has sent out that, the first people who they want to be signing up, which is those people working COVID units, people doing testing, people doing even the vaccinations, and long-term care facility workers for sure.
So there's some granularity or specificity within that guidance.
George,
yeah.
We just spent the last hour with Brian Chogny, and they have a plan. They know the order. They know what they're going to do, and it's not going to be reception people. They have a plan for who gets the vaccine. So it's being very carefully taken care of.
And so Dr. Sharp, do you see long-term care facilities being prioritized quite high in this?
They're in the first group.
Excellent.
Mhm.
So is everyone going to, because it's not a terribly stable vaccine, so is everyone going to have to come to the Bloomington Hospital site?
So they are at first, at least. Our pharmacy is really heading up that cold chain because it isn't, like as you said, there's so many steps to that. So our pharmacy will be housing that sub-zero freezer there at the basement of the hospital. And behind the hospital, there's a building, we call it the Medical Arts Building. That's where the vaccinations will take place. And we're ripping off parking for that facility. Right now, because of COVID, everyone who normally worked in that area is working from home. So the whole basement is empty. So we'll have that as the site, but the pharmacy is right across the street. So it's easy to bring the vaccine over and keep that cold chain the way it needs to be.
I think that this is going to be a topic of great interest to people. So I would encourage both parties, the hospital and the health department, to be very public about these plans. And I know we're public right now, but I think that the more the better, because there is so much curiosity and so much anticipation out there that and this is such a busy time that I can't even imagine you guys' jobs right now. I can't even imagine that. And now I guess I'm asking for something on top of that, is to sort of go out there and do maybe a little bit more, because we get the inside scoop, but I think that this is important to be broadcast.
Well, this is on our agenda. We have the Friday press conference, and this is exactly one of the topics that we have set aside for the press conference so that the media can share that information. And the state website, the state plan, and how that is triaged out. So who's in phase 1A and phase 1B, all of those are listed. It's on the state website as well. But you're right, there's going to be lots of interest in that. And the people who want it are going to want it, right? And so it is important for people to understand what the order in terms of who's deemed first, one by the CDC and then by the state. So that is absolutely very important. And we don't know exactly how many shipments we'll get, how much will be in each shipment. All of that is yet to be determined, and will depend therefore on how those appointments look. So I'm grateful that the state's kind of handling that.
Yeah. I'm just concerned about the outlying counties because, as you know, their rates are higher than ours. And there's a bunch of nursing homes that aren't doing very well in some of those counties. There's a few smaller hospitals as well. So all those people are going to have to come into Bloomington to get, and we're not going to try to do any, and there's no way to do outreach with portable freezer things or anything. It just seems like, it seems unreasonable to expect people from all these surrounding counties to come in to get, and it seems to me that's a barrier to vaccination, basically.
I think that's why the 1B is going to be coming right behind 1A so that it can get out a little bit more and be using other vaccines that don't require so much handling.
The other thing,
have you heard, I'm sorry, Amy, I don't know if there's any discussion. I'm sure there is, because I've worked in hospitals and everybody always wants to know, is this going to be mandated is this a mandate in order to come to work now? From now on, you must, if you're a frontline caregiver, have received the Pfizer vaccine
I don't know of any facility mandating it yet, and IU Health is not.
The other thing I was going to add is that CVS and Walgreens is helping with long-term care facility vaccinations as well, correct? So,
yes.
So kind of to your point with those long-term care facilities, for example, in other counties, they may have an easier time being able to get it through those pharmacies.
It just seems like that's, it's really high on the list because that's where our highest death rates are and the most vulnerable population we have. And it just seems that that should be facilitated as much as possible and not throw up any extra barriers to them getting the vaccine.
I concur.
Absolutely.
Thanks, Amy. We appreciate your input.
And the last thing that I have is Kathy and I met with Sally about the strategic plan. We should get a final draft this week that we can review for any minor edits and then have that to you at your January meeting for approval. The only thing that I would say about that is how you want to handle the decisions that you had around racism and disparities and what have you, what you wanted to put in there. We spent a lot of time yesterday really kind of talking about how can we incorporate those objectives. What objectives could we incorporate for the board, for example, on how you want to make those assessments, develop policies, all of that, and couldn't honestly come up, with that discussion with a very meaningful, value-added objectives. We just sort of got swallowed by the magnitude of the issue. It's enormous, right? And so I would ask if you want something in this version of the strategic plan that perhaps you come up with that one objective for what's that one thing that you would like to do to ensure that more objectives are added to the strategic plan. The strategic plan is not a one and done document. It's living, it's breathing, it's constantly being reviewed and revised. So we can always add to it. But we are already essentially behind in terms of the process of our strategic plan. And to drag this into 2021 means that all those dates drag through, and we'll probably need to amend our agreement with Sally's business. Because we've worked with her before, I tend to just refer to her as Sally and not the name of her business, which is, I guess, what I should be referring to. But I just don't want to see us rush into an objective or something that isn't meaningful. I would rather see our strategic plan reference something, continue the work, and then come up with some really meaningful objectives and goals around this issue. So that would be my only comment in terms of the strategic plan.
Mark, I'd like to hear from you on that since you've been so involved with the strategic plan. What do you think?
Well, I'm wondering, because we all had a chance to weigh in on the draft, right? So I would have maybe expected that Sally would have taken that feedback from us already, and I would have expected each of us to have given good feedback on that topic. So I'm wondering why Sally's not able to come back with something definitive from us that we said back in November. You follow what I'm saying? Is it still indeterminate? Is she uncertain?
Well,
At this point,
isn't it our strategic plan and not Sally's? I mean, Sally's guiding, but
yeah, but we've, she had some placeholder objectives in there on racism as a public health threat. And then we were supposed to react to that and all the others. And I know I did, right? And I gave my personal input on that. And that's the last I knew of, right? So I was assuming that she was going to be incorporating our feedback on that version, but she's still uncertain as to what to do.
Well, she did, and that's what we reviewed yesterday I believe it was yesterday that we went through that. So we did take the feedback that everybody gave us, whether or not it has what you want and the depth of what you want would be my question. And so, I mean, one option is to simply look at the final draft when it comes later this week and then, go forward. And if you want to add something to it, then you can do that.
Yeah, to me, it just seems that that's exactly right. I mean, we can't make a determination how much we want to change it until we actually see it, see what maybe she incorporated some of our feedback, Mark, and so we won't know that till we see it, I guess.
I guess from my perspective, from Kathy, from Sally, from the three of us, I'm not sure that we've captured what you really want. There's certainly the feedbacks in there. And maybe we have, maybe it's just that we don't feel like we have. So, I think that that's fine. We can give that to you. The intent is for her to send that to us this week. I can send it out to you if you have strong feelings about something. We've got a quick turnaround time so that we can have a true document to give you in January.
Yeah, that would be a good idea. If she could incorporate at least that, if that's the most, maybe not contentious isn't the right word, but if that's the most questionable part and we're really uncertain how we want to state things, I think it's important for her to go ahead and send us at least that portion so we could review it and then, maybe decide in January exactly, have some ideas how we want to change it or even before.
Yeah. I mean, we sort of had a straw man in November and we reacted to it. Now we need to have straw man 2. And I would expect that, there might be tweaks on it, or maybe somebody has some big idea that needs to be added to it. But if it just comes with the draft of the whole plan, I wouldn't be opposed to that. And we react to the whole plan, including that component, in preparation for approval.
Penny, do we actually have a deadline for approval for this?
Well, the contract, because of COVID, we've kind of lengthened it already. This was supposed to be done this fall. So, pushing it into January for approval is pushing it about as far as we can without amending our contract and paying Sally some extra money.
Well, then I think, maybe Sally should give us what she has.
I mean, I guess my point is, from a strategic plan, we look at it regularly and you're always making changes. So we can always add to it. That's.
Yeah.
I mean, if there's some simple changes, I think that we can certainly address those quickly.
It seems to me that you're not comfortable with this section, that you're not, you're not bringing up any of the other part of the strategic plan. So it sounds to me like this is a part of you haven't really come to grips with, and that you might want more feedback from us.
Yes.
So to get that, I would prefer just looking at that very section. That's the real issue. And because it's a time issue basically, and so we can respond quickly to it, as opposed to responding to the whole thing, because that takes a considerable amount of time. If you want a quick turnaround, then maybe just getting what you have from that section to us so we can actually address that.
We should have the whole draft tomorrow, and then we have maybe a week to get it back so that she can take it to her final editor. But you know, that even with that piece, that will cover several different goals. So, but I will forward it to you as soon as I get it.
I guess, and I think what I really want to know is what part of it are you guys not comfortable with exactly? Because I think that, I think that's, it sounds like that's what you really need us to address. So it says we have looked at this a couple of times in the past. So, so it sounds like that's what you really need us to address. So maybe you could highlight what you're uncomfortable with, or just so we know what exactly your concerns are.
In my mind, I'm thinking haste makes waste, and we want this to be thought-provoking. We want it to be a document that means something. So,
right. And if I could say that I think maybe the superordinate goal here is to put a marker down, you know, in a general sense, that this is something that's important, but we don't know quite what the objective, what the tactic is, you know. So to get all granular on it, but I think it's just a way to say this is important, to highlight, and an objective, you know, in the strategic plan can be to create a sub-plan. That's, you know, maybe
that's right.
You know,
I agree. I think we need something to react to.
Anything else there, Penny?
I think that's it.
Okay, how about health regulations review discussion?
So, you know, we went to Orange. We added the health officer. We went with closing the restaurants and bars early. We lowered the gathering size limit to 25, and Erin is here from Security Pro. The compliance officers have been going out each week, usually on Wednesday. Our staff that handle complaints send out kind of a list of the top people that places they've gotten complaints on. We kind of go through that and then forward that on to Security Pro so they know, you know, who they can help us with this week, and make sure that those places are in their list of places to visit. And they have a list of our retail food establishments that they go through. So I can let Erin talk to you about how that's going. We're very pleased. And we're very pleased to say that they're willing to help us with our security when it comes to vaccine delivery. So we're pleased about that as well as the sheriff's office department is willing to help with that too. So I think between the two of them, we'll have good security site plans in place for that. But unless, I mean, Dr. Sharp may have different thoughts or something he wants to share, but I feel like the regulations, we've gotten good response. I think they seem appropriate. We're still in Orange. I see them as still appropriate. The hospital is seeing, you know, a high number of cases, and, you know, the hospital's full across the region. So I don't think that this is the time that we want to think about lowering those regulations. But if Dr. Sharp has anything he wants to add, he can add that, but just wanted you to be able to talk about those.
Yeah, the hospitals aren't actually full, but we're trying to keep a cushion. And so some patients have actually been transferred to other places in the IU health system, specifically Methodist. And there's a cushion. We're okay. But it's very busy, and staff is, they're somewhat overwhelmed. We need some of them are, but IU made a very good tactical shift early on and added 420 workers back when it wasn't so much of a problem. So we have a cushion with workers, and we were very lucky about that here in Bloomington. The foresight there was spot on. So we're not in trouble, but we're really busy. So we'll see.
Hey, everybody, it's Nicole. I just have a quick question. I had a vendor from the farmers market call me this afternoon. Right now, we are allowing those vendors in the market to have 2 employees at their booths. This person wants to up that to 3, but the booth size stays the same. I told him I would bring it to you all and let you kind of decide if that's something that you think is okay, or Penny and I have talked about it previously, and the problem that we find with that is that when you have that many people in that small space, then you end up having more close contacts should someone get sick. So I just said I would throw it out there and see how you all felt about it. And Penny, I know that you and I've had that conversation in the past, so if you have new input on that too. He literally just called me about 15 minutes before we started this meeting, so I told him I would bring it up.
It's also true that if you have more workers there, you can move people through more quickly.
That was his one statement as well. I think that he has copied you on a couple of those emails as well.
Yes.
One of the things that we had talked about before was can a business or vendor have 2 people at the booth and 1 person perhaps being more of a runner that helps people maybe out with their things or something like that, so they're not standing, so you don't have 3 people standing behind a 6-foot table or a 10-foot table. But
the other concern that I have this week is, in November, the farmers market, the winter market does have less vendors. Starting this week, there will be more vendors in that space at Switchyard. Actually, Muddy Fork, who is asking about the 3rd person, is moving from outside where he was previously setting up just outside of the Switchyard doors, and he's moving his tables inside this week. So I don't want to overrun the space that they have. And my guess is with the weather getting colder, they're not going to have those doors as open as they have previously. They may still have them cracked. I haven't heard otherwise, but I doubt that they're going to be full open like they have been with the nice weather we've had in November.
Who sets the distancing for the winter market in the pavilion?
The booths are actually situated 10 feet apart right now. The market master and coordinator has that set up that way. They're not allowing more vendors than they have space with that 10-foot distancing between the tables. But that being said, when there's a line forming, there still has to be 6 feet right between, because if any of you have been to the winter market at Switchyard, they have 2 technical aisles that they go down, right? They have one, and then the booths are on both sides of that aisle. So we just want to make sure that there's enough space for the people to stay 6 feet apart in between, and that there's enough space for the people behind there to have 6 feet by them. And it gets pretty, previously with the amount of vendors that they had, it gets pretty crowded in there in the winter. So I didn't go to the winter market when it was at Harmony School. Sylvia always went to that one, but I can't even imagine what it was like in that small space, because this space is a lot bigger and it still seems crowded to me.
Nicole, are all the booths the same size?
I think that's really up to the vendor on what they're selling and how much space they need. Typically, their tables are about 6 feet long, and they have a 6-foot table in the front and at least one on the side or one behind them. But there are a couple of the produce vendors that have a more extensive product list that do have a little bit longer or a little bit larger of a booth. And those vendors who previously were doing prepared food items that now everything has to be prepackaged, some of them had a larger space as well. I know last year Brown County Coffee had their own basic space in the back that took up, I mean, it was huge because they did so much business there. So I think that it really right now is pretty much down to 6 feet just for spacing purposes. But if they do have more product than that, then they're allowed to have a little bit more space.
Well, to me, the fact that you add more people would also be a determinant on how large or how small the booth is. But if for small people, for small booths, to have 3 people in there, that just may not be safe.
Do you think that there should, maybe they have to have a minimum booth size in order to add that extra person, or do we want to just say no and or say that they can have a runner, but that person can't be behind the booth with them? I mean, I guess we could do it either way, or one of 3 ways, really.
What do you think, Dr. Sharp?
Oh, I thought you were going to complete a sentence. Well, all we have to do is do the policy. The particulars are that's the problem of the market master. So what we need to say is 6 feet apart, and obviously that would if you could do that with 1 or 2 tables and have a runner, you know, that's not unreasonable. But the runner you can't have 3 people in a small space, because then you're constantly too close to somebody. But George, that thing is really true. If you don't move people out of there, and I've been to that market, and I was at a time when it was quite well spaced out, actually. But if you have that, if an extra person makes it more efficient so you can move people in and out, you know, that makes sense to me, because you don't want to have them accumulating. So, but the market master, what we need to do is tell the market master how we want to run. And, you know, I can, you know, I enjoy going to those places, so I could easily just slide by there sometime, or the health department can, or the security can, except you don't work on Saturday mornings. Security, I don't think.
I was gonna say, I can work with Nicole, and if we need to adjust some hours on the weekend or something like that to free up some daytime hours, we can do that too. I know we've been getting some daytime stuff because a lot of the complaints that they've been getting lately is restaurants. We've been doing those during the daytime, so it wouldn't be a big deal for us to run through there during the daytime too, to help you guys out.
Okay.
And I will say that that market is on my list this month. I am going to go out there probably in the next week or 2 and do inspections on that Saturday morning for all those booths anyway. So that's on the agenda.
Yeah.
Yeah. So Nicole, you could talk to, who is the market master?
Teresa Bertles from Heartland Family Farm is the one who's been coordinating most of it. There's actually, I think it's kind of a co-op, the Winter Market Co-op, that kind of works together. I think there's almost a board that they go to that does all of it.
So if the board wanted to just say, here's what we want, and on a trial basis, a runner who's not waiting on people, not behind them right there, so that we never have 3 together at a table. You know, if you give that kind of direction to the market master or to security or just to the health department, that's what we need, is how you feel about that. But you know, that's probably doable, especially the runner thing, running back and forth. If you have 2 people and somebody has to run to a truck somewhere, then you only have 1 person. Then you really have backup. So, George, I hadn't thought about that efficiency angle, but that's certainly true.
Yeah.
You don't want people waiting. Yeah.
No, and I think that for them, for some of those places, I think that yes, it is needing a runner, but I think for some of the other ones, it's more about packaging and taking payments in 2 lines to move them through faster, is kind of what it sounded like, which is where my concern came in as far as space goes. But if it's just a runner, I don't see a problem with that either. But if it's 3 people behind a 6-foot table, that gets a little bit crowded.
I agree.
Nicole, has this question come up with respect to any of the other markets, the one out at Blooming Foods East or the one at the stamping mill off Tamp Road?
No, Blooming Foods East, the People's Market is actually, for the winter market, is going all virtual co-op. So everything that they do is going to be a drive-through platform. They're not doing anything other than online sales and drive-through pickup. And then the only other market in the winter is this one at Switchyard. And the only person who's brought up, there's only been one vendor who has brought up concerns about the amount of people that they have working behind the booth. So
Good, thanks.
I'm not surprised. I even anticipated that it might be Muddy Fork Bakery, just speaking of firsthand experience, because I have been to that market 3 or 4 times. And Muddy Fork has been outdoors, and it's a good thing they've been outdoors because they have as many as 10 or more people in line at one time. And the line does move reasonably quickly, but with that many people and them moving indoors, moving them out much more quickly might be worth the additional risk. You know, it's a risk benefit ratio here that we have to balance. So it might be better to have them have the extra person, have this minimal amount of risk with those people right there, as opposed to having all these people standing in line, because they do have a pretty good line.
I like Dr. Sharp's solution, the rule of 6 feet separation, and then following it up by either Nicole or Aaron checking to see how things go at the market on a reasonable near Saturday.
I agree. Do
I
we
can
need
do
a
that.
vote? Do we need a vote or something on this, Penny, do you think?
I don't know that you officially need to vote on it because really that's kind of more of a health officer and department. But I will say this, having even, a general vote from the board always holds weight. So that is absolutely for you all to take a vote on it, gives us more backup, if you will, on what you want.
I think Dr. Sharp holds weight too.
Oh, absolutely.
I think we ought to back up Dr. Sharp in his authority to go for that.
Shall we delegate?
Yes, Steve, we'd like for you to go down and inspect.
Margie's on here. She can chime in.
Hey, Steve, I have an inspector going on maternity leave. If you want to come with, you're more than welcome.
Hey, sure, as long as I get one of those croissants. I tell you, you should have one of those croissants from Muddy.
You're working. Thank you.
Their line is always so busy. Even, every year it's like that. It's pretty impressive.
Well, can we just say, is there anybody opposed to Dr. Sharp's suggestion? Are all board members in favor of Dr. Sharp's suggestion?
Aye.
So
Yeah.
that's kind of an informal.
Kind of a voice vote.
Yeah, go ahead and do a voice vote and say we're all in favor of it, and I think that'd be great.
Okay, we'll do it one by one. George?
I vote yes.
Mark?
Certainly.
Steve?
Yes.
Carol?
Yes.
And I also vote yes. Thanks, Margie. Okay, anything else you want to talk about with health regulations, Penny?
I don't think so. And Aaron, was there anything you wanted to add in terms of what you all have been doing?
No, we've had a good couple weeks since we last talked. Obviously, moving to Orange, pose some questions to some of the bar owners and restaurant owners. We've been able to work with Nicole and Penny on that to get them answers to their questions, and it seems to be going real well. It's received real well. People see us coming, and I don't know if they doing what they're supposed to or what, but people seem to be enjoying us being there, and it kind of takes the pressure off the bar owners and the restaurant owners as far as them having to be the enforcement on it. So,
and Nicole.
Yes. So we have, I talked to Nicole. Nicole and I have a weekly meeting here the last couple of weeks. And I was talking to Nicole. It's kind of funny because it's like having a new set of freshmen in town right now. The college kids, they all knew and understood the rules when they went out. And now that the college students are gone, the locals are kind of coming back. So it's kind of like the bar owners and restaurant owners are kind of having to retrain some people because people that haven't been out in a while are coming back out because the crowds are less. So they've done a real good job with that, educating the patrons of the restaurants and everything as to the rules and everything. So, but it's been really good for us. And I hope you're getting positive feedback at the health department and everywhere on what we're doing. And if there's anything we can do, please let us know.
Now, I understood that when you started, Aaron, you were gonna be working through sometime in December. Is that correct? Or how long term have you been hired?
I'm not sure on the exact date. It was kind of more of a monetary unit. And it looks like we're going to get 6 to 7 weekends out of it. But it's kind of moved on to maybe not as much weekends anymore as it is just a matter of time. But yeah, I mean, looks like the 19th is what they're telling me in the office. Around the 19th of December. So the weekend before Christmas.
Don't let that get out.
Yeah.
Yeah, and if I can weigh in on that, this was always thought to be kind of done on a trial basis and with the thinking that if it worked, it may be extended. And so I'm sure that that's a conversation that Penny and the commissioners will have. Obviously, as Aaron pointed out, it's subject to funding if there's available funding for it. It's been successful. I could see it being extended. I think that for my conversations with Nicole and Penny, jump in here if you guys think I'm speaking out of turn, but I think you guys have seen Aaron and his team as being a real big help to you. And I was just on the phone yesterday with a business owner who also appreciated the way that Monroe County is handling enforcement from an educational perspective. And as Aaron said earlier, they seem to be somewhat relieved that we have professional enforcement people in their restaurants helping them to do their job so that they can focus on, serving their customers, and we can focus on educating about COVID regulations. So it seems to be a win-win-win from every perspective. And I could absolutely see it being extended if that's something that Penny would request.
And
You might want to consider at least extension through New Year's.
Yeah.
Yeah, and we want to keep you as long as we can, Aaron.
Well, thank you. We enjoy working with you guys. And like I say, we're excited to work with Penny. We're in discussions with security for the upcoming vaccination clinics and everything. So it's been a great relationship with you guys. We appreciate all you do.
Well, we appreciate the way you've handled it.
It really gives the owners something to go back on. If somebody's doesn't have their mask on, he can say, because he can say, hey, look, we get inspected at random. The guy might walk in immediately after I turn around and walk away. Well, the security might come. We have no idea when they're going to be here. But if we announce that there is no security, that's a problem. So just the fact, it's like when you drive by an empty police car, you slow down, because you don't know if what he's doing in there, but you see it, and so you slow down. So
Actually, Aaron told me a story this afternoon about the Legion. They went in there, and as soon as they left there, they called the other fraternity clubs and told them that they were out and about and on their way. So they're letting each other know that it's like a student telling on the other student, letting them know that the teacher's on its way,
Yeah, so
Actually, that's great.
You took care of all those places just with one
Aaron,
visit.
you didn't even have to go when you had to.
Yeah, exactly.
Yeah, exactly.
They were waiting. Well, and I've even seen some social media posts from some of the restaurants that have said, hey, the health department, just got visited by a compliance officer, yes, the health department's really sending people out to check. And it was not a complaint at all. They were glad, and then they went on with their normal information about what they were doing. So I've seen a couple of those. Yes, they're really checking, and yes, we did well. You know, that's kind of their moment to say they came by and, you know, we passed, if you will. So, yeah.
We'll take whatever works.
Yes. And I guess the final thing that I would say that I kind of almost forgot, we're meeting actually a little bit later this evening with IU to go over our plans for the spring with the Greek housing, communal living, so that we have kind of taken the feedback that we've gotten from us and internally and the processes that we've found that were clunky, but also from the meetings that we've had and the conversations with the housing directors and corporations and all of that, trying to streamline things using kind of a stoplight approach, if you will, so that houses also know what to expect. So I think that will be very helpful. And then we'll be getting a questionnaire out to the houses probably yet this week, so that they can begin working on the information we need to make some of those determinations about what their capacity for isolation and quarantine is.
Penny, is this the meeting that would be useful for me to be on? I didn't know about this one.
Certainly, we were just going over, and I sent you all the draft just as FYI. So when I get off this meeting, I can send you the link if you want to join us. Absolutely. It's as soon as this is done.
What time? It's right after this?
Yeah.
What time is it officially?
Well, I think they're officially starting at 4:15, and I said whenever this board meeting is over, then I will join. So.
Yeah, I wouldn't mind listening in on it.
Yeah, that would be great.
I've been involved with it for so long, and I found that document to be rather confusing personally.
Okay, great.
So, it was written by people who clearly knew what they were talking about, not by people who don't know it. And so reading it as an outsider, as an outsider, I found it very confusing.
Yeah, that's helpful.
So, yeah,
okay, now I'm done.
Okay, are there any other board comments? Any concerns? Before we close, I want to ask once again, are there any public comments that someone wants to make?
There are no hands raised.
No hands are raised, so we need to look at a date for our next meeting.
Yes.
I have a calendar here nearby.
That's the calendar. So Penny, are we going to need to take action on stuff coming out of the sorority, the regulations, anytime?
Unless you want to change them, I'm thinking back to the last meeting, and I don't think that you had any changes that you want to make. So if you do want to make changes, then that would make sense to get that out sooner rather than later. But when we talked last meeting, I think we were good at leaving the capacity the way it is. And that was really probably the big issue for them in planning was capacity limits.
I think that seems reasonable. I just want to make sure we don't do anything last minute changes. They're going to throw them off because they will be coming back. So
right,
sooner as opposed to later.
Absolutely.
When they come back, they all have to be tested, by the way.
Okay. It's been 3 weeks since we met last time. If we went 3 weeks again, we'd be right before Christmas. Do you want to wait till January?
What your normal meeting would be, in January, you could do it on the 5th that would be the first Tuesday. If you wanted to do that, we would have to do our if you decide now, we can advertise the meeting now. So we're kind of out of the, we don't have to worry about getting it advertised over the holiday, so.
Do you see any reason for us to meet before the holidays again, Penny?
At this point, I don't, unless you can think of something. If something comes up, we can certainly call a meeting within 40, we have to wait 48 hours, but.
Do we need to just if you're sending out that section on the strategic plan, do we need any kind of informal discussion on that prior to that meeting? Because if we do decide on some change, well, that puts us back into a pretty long meeting again on that Tuesday, and that's our deadline for approval, right?
Yeah.
Why don't we did you say you'll have that finished?
Should have it, I think by today or tomorrow at the latest, I think.
Okay, well, if you mail that out as soon as you're able to, then we have a look at it. Maybe we could do some informal feedback back to you or Kay, and between the two of you, you can decide whether we need to have a short meeting before then.
No, can do
Sounds
that.
good. Okay, so shall we say January the 5th?
Yeah.
It works.
Sounds good.
What time do you like? I like the 3 o'clock. How about you?
Yeah, I like the late afternoon time too, as opposed to evening times. If that works for Margie and Penny.
Yeah, how does that work for you, Margie? Penny?
That works for me.
What about Ashley? Doesn't she work?
She works for the county, so I know that, and I don't know what the issue was today, but I know that it can be difficult. What if you did it at 4 instead of 3? I mean, it's earlier than you normally did it when it was at 5:30, but it is, after county hours would be over at 4, so.
That works for me.
Works for
Okay.
me.
If you think that'll work better for her, I think that would probably
That's a
be
good idea.
fair.
Does that work for you, Mark? Are you teaching or something that works?
That works for me. I don't, for some reason, the spring semester is starting a little later in January this time, so I've got like an extra week.
Okay, we'll set it January the 5th at 4 o'clock will be our next meeting time.
Okay.
Thank you,
All right.
everybody. We're adjourned.
Thank you.
Thank you.